South African authorities are concerned about the increasing number of deaths linked to the cholera outbreak. 22 people have now died. The Free State province also reported its first death. With the increasing deaths and cases, should the country, we're asking, buckle up for the worst? Let's bring in Health Department spokesperson Foster Mohale, who joins us via our video link this morning. Foster, it's great to see you. Thanks for giving us some of your time this Friday morning. How much should South Africans and the country brace for perhaps what's to come?
Good morning, Michelle, and good morning to your viewers at home, and thanks for this opportunity once more. Let me take this opportunity to first extend the words of condolences to the families of 22 people who have passed away due to the outbreak of cholera, since the outbreak both in Gauteng and Free State, but also wish all those who are still admitted in our facilities a speedy recovery. In terms of backing up, so now we say there's no need for public to panic, but what we are doing, we say they must be vigilant, they must practice personal hygiene, sanitize at all times, wash their hands, and also we want to appeal to anyone who experience cholera-like symptoms not to waste time. They must go to their nearest facility so that they can get medical attention on time, because we've observed that people present late when they experience signs and symptoms of cholera at our facilities.
Yeah, absolutely. You know, a number of professionals have weighed in. We've had epidemiologists who we've quoted here on the program talking about what the best course of action is insofar as trying to track down the source of this outbreak. Foster, are these the kinds of experts the department is also bringing into the conversation to find out what the best way forward is?
No, definitely. Yesterday, as the acting Minister of Health, Dr. Newzroom Afrika visited the hospital together with a team of specialists from World Health Organization, the National Institute for Communicable Disease, but also including with our own internal experts in order to try to find out if the current interventions that we have in place, are they achieving their purpose. So in order to consider more interventions, yes, we are going to bring as many as specialists from different fields as possible in order to assist to arrest the spread of this disease, but also try to save more lives.
Can you give us a sense of who those experts are, Foster?
We've got the different experts. We've got the epidemiologists. We've got those who specialize in they call the gastroenteritis disease. Those who specialize with the disease of the stomach, diseases of intestines, and also we've got other specialists like we had during the time of COVID-19, especially from different fields. So we are trying to bring as different specialists as possible in order to ensure that we continue to save lives. As you know that even other departments like your Department of Water and Sanitation, working closely with the water authorities, the city of Tshwane, they are also continuing the investigations to find out what would be the possible contamination of water in both Hammanskraal and also in Free State.
Yeah, and I imagine there's going to be plenty of engagements with not only the health department, but with other government departments as well. It has to be a concerted effort and an effort that is sort of a joint one between various government departments. Of course, water and sanitation will be a key member of that sort of response. Tell us more about, what the focus is now. We're coming from a couple of days where we've seen the death toll increase. We're now at 22 deaths. Going into the weekend, given that people are still in hospital, many of them critical, what will be the focus?
Yeah, we are even parallel focus areas. For example, those specialized with water quality, they continue with the investigations of all the water systems at different points at different times. As we know that testing water is completely different from testing some blood. When you test water, you need to take samples from different points, not only at the plant, but also at different points. So also with regards to health, we are trying to intensify awareness in order to educate our public on how to prevent further spread on how to notice different types of cholera-like symptoms. We talk of vomiting, dehydration, diarrhea, stomach cramps. So we also try to ensure that, for example, yesterday when we visited Jubilee Hospital, there was a decision that was taken that because majority of people, especially in Namaskar, those who present with the cholera symptom, they come from a village called Kanana. So we decided that we are going to set up a mobile facility where we're able to treat them timely in their own community, instead of them waiting to travel to the nearest facility, which is Namaskar, so that we're able to divert them to different hospitals instead of us only directing them to one hospital, which is Jubilee Hospital.
Mm-hmm. So you've raised two important issues there, Foster. I want to ask you a question, and it does have two parts to it. On the issue of the gastrointestinal expert, which the hope from the department was that person would be stationed at the hospital, Jubilee Hospital, from today and for the next week. What's the status of that? Is that now confirmed? And then secondly, the issue of awareness was a big issue at the beginning stages of this outbreak, with many people whose families were admitted to hospital and some of them who died, saying that they had no idea that they were not meant to drink the tap water. So can you give us a sense on those two issues, Foster?
Yeah, with regards to specialists, we have roped in specialists from different hospitals like your George Mukhari Hospital, north of Pretoria, big hospital in the CBD, in order to capacitate and assist the current workforce at the Jubilee Hospital. But also, as you know, that the issue of capacity as well, and also the equipment, we try to ensure that we don't put all the patients in one hospital. Hence, we have to try to transfer some of these patients to George Mukhari, to Steve Biko, and other local facilities. But with regards to, what was the second question, by the way?
The issue of awareness, Foster. How do we ensure that everyone knows what the safety measures are insofar as this outbreak is concerned?
Okay. Yes. In fact, we've never stopped, even from the first case that was detected. I think the first two cases that were detected imported from Malawi. Ever since then, we have never stopped with our awareness campaign, even though we were zooming into the affected areas. But now we have realized that the problem is spreading across the country. So we are no longer going to focus only in the areas of outbreak, but we are going to communicate and raise awareness across the country. Hence, we've brought all the provincial government, the departments of health, all our partner organizations, the NICD, the World Health Organization, the municipalities, in order to ensure that we intensify awareness, we educate our people, we empower them with health education in order for them to make well-informed health choices. So that when we say, please don't drink a tap water in Namaskar, only consume water that is supplied by water tankers, at least people will be able to heed our call. Yeah. When we say whoever experiences cholera-like symptoms, don't wait until it's late. At least people will be able to come to our health facility. So we've got our food soldiers, we've got community healthcare workers who also assist us on the ground in order to raise awareness about the cholera and other diseases.
So, Foster, this isn't the first cholera outbreak in the country. How different is this period compared to previously?
Yeah, remember the first case, I think, was this year alone, the first case was detected, I think, around March. Yeah. But you remember that the last time we had the cholera outbreak, I think it was almost 10 years ago, which were the imported cases from a country of Zimbabwe, which were imported into the country through the border bridge, Bed Bridge, border gate. So, but of course, for now, we take this current outbreak seriously. We are trying to arrest the situation to ensure that this does not become another COVID-19 pandemic.
Absolutely. Foster Mohale is the spokesperson in the health department. Thanks very much indeed for joining us this morning.